All right, I am going to show you a Travell trigger point release on the SCMs as well, just because they're a delicate muscle in a delicate area, and I want to show you what it looks like to use a pincer grasp to treat the trigger points with a Travell trigger point release. You can also treat with a pincer grasp the upper trapezius. Sometimes you can even do pincer grasps for the biceps and some of the other muscles. You'll have to play around with it. Depends on the musculature of the person. It is a really effective treatment, but remember that the pincer grasp is actually a more intense treatment because you can grab the trigger point, the muscle fibers from two sides and squeeze them, and that is actually more pressure than if you were just coming at it from one side. So it can be a little bit more painful. So you have to be very cognizant of that. Remember that Travell recommends using moist heat, but we can't really use moist heat on the SCM. It's not appropriate. The anterior neck is an endangerment site. There are far too many vascularities in this area, and so we're going to warm it up using massage techniques. So we can use our massage techniques. We can do some muscle stripping, maybe with 2 fingers, just to warm up the muscle. And then if you want to palpate with a pincer grasp, it's really different on everybody. It depends on, some people have really short necks and a lot of tissue there. In that instance, you may need to roll their head away like I'm doing with Paige here in order to access the SCM. But if you rotate the neck to the opposite side or the head to the opposite side, you'll find that actually it puts the SCM on a stretch. So if it's already tight, it's going to be difficult to grasp with a pincer grasp in this position. So what I like to do is actually roll my client's side to the same side. And this works exceptionally well when they have a longer neck and it's a little bit more palpable. You may have to play around with it depending on your client. So if I roll her head to the same side, the SCM goes on a slack, and then you can see here that I can grasp it easily with both hands. So I could find a trigger point using this pincer grasp palpation technique. So let's say I found one here. Is this tender at all?
A little bit.
A little bit. So we're going to pretend. And this is what you're going to do for your exam too. You're going to pretend that you find something in the muscle that I quiz you on. So Paige, on a scale of 0 to 10, 0 being no pain at all and 10 like putting your hand on a hot burner, where would you put this?
1.
And remember, you have to actually be applying pressure at that point when you ask them how it's feeling. You can't let go of it and then ask how it is on a pain scale. They need to be experiencing the discomfort at the point that you're asking them about the pain scale. So it's only at a 1, but let's pretend it was at a 5. And then I would ask the third question, which is it radiating?
Nope.
Okay, so it's not radiating for Paige, but as you know from the lecture videos, the referral pattern for SCM comes up. It can come to the back posterior aspect of the head, into the temples. It comes up and around, over top of the eyes, and even a little bit on the top of the head and under the mandible. So don't be surprised if when you hold on to a trigger point, they get a referral pattern into that area, and make sure you make a mental note of it to put into your charting notes. So I wouldn't have let go, but so I'm holding on here. It doesn't refer anywhere. I'm going to get her to take a few breaths as I maintain a static pressure. So I'll get you to take a few deep breaths there, Paige. And we're waiting our 30 to 60 seconds now, or until you feel a release. And a release feels much like it did with the Golgi tendon organ and muscle approximation techniques. The muscle just relaxes. Sometimes you'll feel that twitch response that we talked about. Sometimes you'll get a jump response. Sometimes the area will heat up and it will feel warm under your hands immediately. There's a lot of different reactions, so make sure you're paying attention to what's happening under your hands. And then where would you put this on the scale now, Paige?
0.
At a 0. Okay, so it's gone. And so we will relax our pressure here, let go, and then we want to flush the muscle out. And this will become very, very important, especially with Travell's trigger points. We would never use 30 pounds of pressure in this particular muscle at all. It would never be appropriate. So make sure you flush out well in this area. Again, hydrotherapy Probably not recommended. You could always apply moist heat to the upper trapezius if that muscle was also affected, if it was one of maybe the synergist muscles or antagonist muscles that was in the affected area. You could also add some hydrotherapy onto those, but make sure you flush out this area really, really well before moving on.